Pamela Worth with the Encourage Your Wellness podcast. And today I'm super excited. We've got Dr. Tony Ebel, lead writer, educational guide for PX doctors, certified pediatric and wellness chiropractor with 15 years of clinical experience, teaching, training other pediatric and family chiropractors for at least 10 years. Spends a lot of time with pediatric neurodevelopmental challenges such as autism, ADHD, sensory processing disorder, epilepsy, anxiety, and so much more. Thank you so much for being here.
Yeah, this is such a blast because I love providing care to my patients, but you can't provide care until you talk about it first, right? People got to find out about it. They've got to learn about it. It's got to make sense of it. So I guess that's kind of was encompassed in the bio there. I write articles about it. I get on podcasts about it. I do videos about it. Sometimes my team makes me do awkward, uncomfortable dancing Instagram reels about it. So thanks for having me, Pamela. I love doing this stuff.
So what does all of this mean? Someone potentially has a diagnosis. They need additional help. Where do you kind of come in that's different from other providers where you kind of complement and communicate and support? And what does that look like?
Yeah, that's a great question. In fact, I think that might be the most important question/answer we try and get across to our audience is because when you go to help your child heal, especially if it's something big, right, into the chronic illness world of autism and all the different layers, unfortunately today, when we take a patient in, it's pretty rare that they only have one challenge they're up against, right? And so what can be overwhelming for parents is after you kind of exhaust the traditional medical world and, you see this specialist and you kind of get this dismissed and this sent over here. Well, then you get into our world, which is natural health and holistic health and a lot of different words we could kind of call it to categorize it. And it's exciting. And then it's instantly overwhelming, because there's so many solutions inside these Facebook groups and everything else. So the real difference with a nervous system focused pediatric chiropractor. So our title is kind of a mouthful, but it's intentional to have those important descriptors. Is what is different is early in my career, I thought the best way I could help kids is if I became everything to every one of them. And so I studied everything about primitive reflexes and motor tone and gut microbiome and detoxification and chelation. And so it's pretty common to see these out there today, but this is going back 13, 14 years. We had this integrated, multi-professional clinic. And on paper and in the pamphlet and on the website, that looked awesome. But where this is going is the difference, and the cleanest answer I can give you that is, out of all the things that I did, I found that there was one of them that was more potent and more effective, especially in the initial stages of healing. And that was to really tap into and address a child's central and autonomic nervous system. Because what happens is there's a sequence to getting sick, right? And so we call it the perfect storm, where kids are going through a lot of actually emotional trauma during the pregnancy and prenatal period because we disempower and we don't support our mamas. And then there's a lot of physical trauma from birth interventions. And then they become susceptible to toxins and their gut's a mess and everything else. So long story short, what we do that's different is we're able to really get into the foundational challenges, which is the central and autonomic nervous system. And so if a lot of families feel like, man, I've done 17 different things and I'm doing all the right things to get a kiddo to heal, sometimes I almost like to call the nervous system part of this, Pamela, not even necessarily the first step, more so almost like the foundation or the table that healing happens on, and so that's what's really different is we really, really dive deep into the function of the nervous system. And for a lot of kiddos and a lot of patients, that's actually where things are stuck.
Yeah, which makes a lot of sense. We recently had Dr. Richard Jacoby on, and he spends a lot of time, he believes all illness is rooted in the nervous system.
Yes, ma'am.
And by controlling a lot of that inflammation, then you're able to bring all of that back into place. When people think chiropractor, they probably think movement. Yeah. And I'm sure there's movement going on. What other types of things do you do in addition to movement? And then what types of movements do you find are most impactful?
Yeah, game on. That's perfect. Yeah, the adjustment itself and everything within chiropractic would be in the movement sciences. So, sorry, parents, I am a super nerd. So I'm an Iowa farmer mixed with a super nerd. So I'll go nerdy, then I'll make it farmer, and then we'll go nerdy and make it farmer. But so I started my undergrad, and this is what I think is the best pre-training for chiropractic is in kinesiology. Now, that's the nerd word for the study of movement, right? And so once you understand how the body is supposed to move, that's step one. Well, then for kids, for pediatrics, movement, motor development is literally essential to brain development. And so we're back to the nervous system. And there's no arguing that. A standard pediatrician knows that, everybody knows that like motor milestones and developmental milestones are the window with which we can look at and say, okay, a kiddo's heading down a good track or they're heading down a not so good track. And so chiropractic is very much in the thick of this movement-based sciences, but it's actually more granular than others. And so now you take this adjustment, which is adding movement, so what's called proprioceptive or mechanoreceptive input into the system. There's two more kind of 1A and 1B sub-bullet points that are super important. Number one is, where are you applying that movement? Well, the neurospinal system, the spine, so most people are obviously going to think chiropractic, spine. But when you say the word spine or you think the word spine, you get a picture of a black and white set of bones, right? So you're thinking bones and structure. You're not necessarily thinking neurology and the brain, but the spine is literally a living, breathing, that's why we call it neurospinal. It's a neurological conduit. And it's not only a neurological like side conduit, it's the central access point, especially the brainstem and that upper neck controls the vagus nerve and the autonomic nervous system. So the first step in this is that movement that an adjustment makes is very potent, specific movement based upon where it is applied. And then the real results, especially with kids and tough neurological stuff, there is a multitude of different chiropractic techniques. And so people ask us all the time, like, hey, what movements, what techniques, what do you guys primarily focus on? And the answer is all of them. One of the things that chiropractic has kind of collectively, I feel like, got jammed up on is, I took this route at first and then had a mentor get me better. But we get stuck on one. Whatever technique that maybe we experience as a patient that helped us the most, well, then bam, and there's over 100 of them in chiropractic. That becomes, we do the same thing for everyone. Well, that's kind of like expecting the same medication, to have the same result for everyone. It's not a custom personalization. And so what we do with our PX Docs network in our practice is not everybody likes it, Pamela, because they have to learn more. The seminar gets longer, but you have to learn a multitude of techniques. And then there's an assessment and a personalization to the patient where we can do pattern analysis of their nervous system and a movement analysis of their body. And we can say, okay, based upon your exact neurological movement dysfunctions, we're going to pair this technique with it. And it's my favorite part of the job because it's super nerdy. And, you get to, I could never have a job where you do the same thing for everybody just because they have a diagnosis. With kids, you just take care of them in such an ultra individualized, personalized way. And that's the fun of the beginning, is finding out, hey, what exactly do you need to heal? We'll figure it out alongside you.
Yeah. And then I don't know if you do any of this too, but I had done this with one of my kiddos who had ADD, not ADHD. But they tried to explain to me how part of the brain was like the Ferrari and the back was like the dune buggy. And so they would have him on like a balancing board, counting backwards with a bean bag and like trying to build these highways, they were calling it. And it did help. We did that around the age of 6 or 7. Well, actually 6, 7, and 8. Do you kind of do some of that stuff too? And
yeah, that's exactly what I was getting at. But I did in the past. And so and this is kind of like a gray matter answer. It's like a little space between the notes. We no longer do inside of our clinic because what happened when you kind of try and become a jack of all trades, all of a sudden some days you wake up and you're like, you're not a master of any, right? And so I feel like what parents need, and that's why I love this podcast and your platform, because you're bringing on a multitude of professionals and giving them access to, because healing is, a child or a person getting sick, especially ADD and everything else, it's a multifactorial path that got there. So we need a multi-integrated approach to get out of there. But the real magic sauce is the sequence. And so what we do is in our clinic, we focus really just on the adjustments, what we call those neurotonal adjustments. And then we've built, and we teach all of our docs around the world to do this. And then we build a collaborative process, because what a lot of families will do is they'll go through all those, I would term that the neurointegrative therapies, the movement-based exercises, the brain training. Some of it now is even computerized, right, with different things. But that's B. If you do that before if the nervous system is still stuck in sympathetic dominance, it's a closed loop. So even if you've got the right stuff going in, it won't go in effectively. And you could actually categorize that for movement-based therapies like that, the wobble board and neurointegrative. You could talk about that nutritionally too, which is the same way as saying then, here's the exciting part. Well, once you get the nervous system to chill out, get the sympathetics to shut down and the parasympathetics on, boom, open channels. And so usually what we do, Pamela, is we have these milestones in a care plan where we say, okay, kiddo, you are now ready for that. And we hand the baton off to a professional or a center that takes care of that. And the results that the child can get from that, if you do it at the right time in the right sequence, is through the roof. So parents just hear, if you've done some of that stuff or all these different things you hear about on podcasts and you're like, we tried that and it didn't work. It may work if you kind of go foundationally, get the nervous system into a better place, and then circle back to that. It's the sequence of things. And not a lot of providers know that because they don't teach us any of that,
Well, so then if somebody I can't imagine that every single person with the designation of a chiropractor knows how to do this.
Right.
So what should people look for? Do you train people nationally if, you're not in an area where someone can see somebody, but they don't trust them? Or what does that look like?
Yeah, great question. It was when, we met through Beth Lambert and the amazing Documenting Hope crew. And when I got done speaking down there, and everybody was so excited with the way I was able to answer this question live at the seminar, because we did train, have trained, do train. We need many more, and we're working on that too. But yeah, my other job, in addition to being in practice, is training. And we have over 1,000 trained PX doctors. Some of them are on their journey to get to the directory. But they are trained. There is a network of them. And a lot of other presenters at the conference, they were just a one-man or one-woman shop, right? And so families were excited to hear about what they do, but then it's like, I've got an 8-month waiting list. And I just couldn't fall asleep at night if I knew that parents could find out about nervous system-focused chiropractic, but not access it. And so that's where many years ago I started training and teaching these clinical protocols to others. And so here's what you want to look like. So on our directory, pxdocs.com, you hit the Find a Chiro button and it's there. But here's what you're going to find. And if they're not on there, sometimes chiropractors haven't learned about what we're doing yet. So there is a few out there that are doing this. What you want to look for is, number one, everything about their brand. And moms, you're smarter than all the rest of us put together. You can do a 30-minute scroll and when somebody's full of it and when they're not, right? So do your scroll. Go to their Instagram, go to their Facebook, go to their reviews, go to their website. And if they just mention pediatrics and the nervous system like on the 17th bullet point, but there's pictures of people with back pain and that's not a pediatric chiropractor, okay? So you can kind of tell. I know this is a 30,000-foot view answer first, but their brand should be really clearly saying, we help kids and we focus on the nervous system, okay? That's just how it should be. Number two, you want to check out and see if they actually use what are called neurological insight scans. So to be a nervous system focused chiropractor, we have to not just talk about it, we need to actually analyze and examine the nervous system. So we use technology of neurothermal scans, EMG, and most importantly, HRV. Right. And I know you're well aware of that one, which is that heart rate variability. And so, because we have to be able to get a baseline of where a kid's nervous system is. And then we use that technology continued. We rerun those scans as care progresses so that you can know you're not just making symptomatic superficial change, but you're making long last improvements to the child's nervous system. So that's the second criteria I always tell parents to ask for. Hey, do you run scans? Do you use nervous system technology? And then number three is you can really find out, you got to get on the phone with them usually and kind of like grill them on this a little bit, but ask them about their care plan recommendations. What I mean by that is old school chiropractic, kids would get adjusted once a month, every other week. In today's world, kids are, I wish it were different, but it is where we are. Kids' nervous systems are so stressed, so wound up, and so disorganized that the way neurological healing or any healing happens, it's frequency and repetition over a certain time interval that makes that neuroplasticity happen. And so a real nervous system focused chiropractor knows that most kids need to start at about 3 times a week. So if you call in and you ask, hey, what's your average care plan, for a child with sensory challenges, or especially if it's a nervous system focused challenge, and if they say just once a week or twice a week, it's actually kind of a little bit of they're not quite up to the current neurological protocols we need. And that's a very granular 3-part answer, but it's our kiddos, so they deserve the best of the best.
So in the neuroplasticity, basically meaning that you're training the brain and training the nervous system, do you find that you have to attack this within a certain time frame by a certain age, or do you feel like you can also make impact, as teenagers, young adults, if people haven't really thought about this sooner?
Yeah, totally. Great. That is key. My start as a patient was a 20-year-old in college. So I grew up full throttle sensory processing disorder, ADHD. So mine, the H is pretty bolded there, Pamela. That'll surprise no one, as we talk into this. And so it almost a blessing in disguise. I grew up in a small farm town in Iowa a generation ago. So I had no clue that I had ADHD, and which was a blessing, because I don't believe, I know that's a funky word. It's kind of like when people say, I don't believe in chiropractic. Well, I'm not a pastor, I just feel like when we give kids or anyone a diagnosis with the word disorder in it, it hooks it. That's part of emotional challenge. So I won't go too far down that road. Where I'm going with this is, so I didn't start getting nervous system focused chiropractic until I was 20. I never could sleep. I never could focus. I never could calm down. I was blessed to channel my energy into sports. Being a farm kid, I was active, so I didn't sit around. There's probably a lot of blessings just in the way that lifestyle was, that it didn't kind of overrun my nervous system. But it did when I was 19 to 20. My life started to really fall apart. I couldn't pay attention. School got harder, junior, senior year of college, and I struggled massively. My lifestyle was also crap. Obviously, I'm on the Jimmy John's and Bush Light diet, back then. So all those things too. So where am I going with my personal story on that? We have a big story with our son, Oliver, and that's our miracle pediatric story. I started getting adjusted, thinking it was for my bad shoulder and bad neck, which is the hub to the brain and had a lot to do with my ADHD, sensory and sleep issues. And I slept after my first adjustment for like 16 hours. I remember thinking like I was in the middle of a movie when I woke up, because I was a kid who never slept more than 1 to 2 hours at a time, right? So when you then sleep like that. So long Tony story to say, I actually got my start as a patient and a practitioner with 17, 18, 19-year-olds. And they went through, and still do today, incredible healing. Now, the rules of neuroplasticity work this way. The longer it's been there, the more work you've got to do up front, and the longer the duration to see results. It's algebra. It's actually kind of a mathematical equation. So when we have an older kiddo who's been through it versus a younger kiddo, they may go through what we call our intensive program, where for the first 2 weeks, we might adjust them twice a day because their nervous system has reached a level of exhaustion almost, right? That's where depression and these things set in. And so we have to really wake up the nervous system before we reprogram and reorganize it. But healing happens for 71-year-olds after strokes neurologically. When you learn about neuroplasticity and specifically vagus nerve stimulation, which is the root of what we do with our techniques, neurological healing is absolutely possible for all ages, all conditions. And the last thing we do is ever put a limit on a kiddo. Even our special needs, genetic population. All right, well, they have certain things within their DNA code that are going to be there, but they have so many things tied to their quality of life where their nervous system gets stuck in sympathetic, stuck in anxiety. They get sick all the time. They're constipated. We just minimize and mitigate so much of that with this work too.
Awesome. How long do you typically see people?
So the individual care plan is personalized to that patient. So just like we were kind of jamming on an older kiddo, going through that's been through the perfect storm and all the nervous system stuff, they may need a 6, 8, 10-month care plan at a higher frequency per week to start with. And I love talking about that right here on the podcast because I want parents to know like healing is possible. And then in a lot of cases, it's a lot of hard work. If there was any other way to do it, trust me, we would do it. I always joke with, my team, I'm the hardest working lazy person ever. If it was a little easier, we would definitely do it that way. So, and then younger kiddos, our favorite cases are getting out ahead of the storm, because conventional pediatricians still today say about colic and chronic ear infections and constipation and eczema and all these things like, oh, don't worry, they'll grow out of it. No, they don't. They grow into sensory spectrum, neurological, autoimmune challenges. So if we start a kiddo in the first, 1 to 2 years of life, that care plan may only need to be a month or two, and then everybody, and then the part B of that answer is you better believe my kids are getting checked for the coolest part of chiropractic is the boringest part of chiropractic when you're a wellness patient, and that's the coolest part of health, period. I was just having this conversation with my kids, my poor kids. We live out in the country and I drive them to school every morning. So, and I love this stuff. So we're talking about our faith. We're talking about core values. We're talking about the nervous system. And, I just said, hey, being healthy is boring. And those that can fall in love with the boring of consistently, so like our wellness patients, 80% of our practice has actually already gone through their healing journey. And now they just come in once a week or every other week to keep their nervous system tuned up and living at their best and just be in our, community. So there's that too for wellness patients. We definitely recommend about a once a week schedule because life is pretty darn hectic and toxic even when we're living as healthy as we can. So that's the schedule we find that keeps families at their best.
Yeah, no, that's cool. And I've met a lot of families with, whether it's the parents or the kids that are on half a dozen different medications. Do you find that you're able to wean some of that off as you go through?
Yeah, big time. It is a process, right? So we talk about our care plan. So like we're talking about with those durations of care. Well, then we get real granular and we break it into a couple of different phases. And having been blessed to start, so when I got into practice, seeing those older kiddos with ADHD and anxiety and Asperger's and epilepsy, they had tried every medication on the market. Right. So they were on 4, 5, 6 of them. And they were basically, many of our patients had a vagal nerve stimulator implanted that was no longer even active. Right. Because anything outside in, honestly, no different than cigarettes or alcohol or different things, the body will become attenuated to it. And so you either need more of it or it just won't work at all. Right. And that's how medications work, especially for neurological conditions. Even when you get a symptomatic sort of kind of like get your head above the water in the beginning, they all fade. And that's not my opinion. That's clinical research. So what we need to do is we need to phase out that care plan for those kiddos. And we do it just in biomarkers. And we say, okay, number one, the reason that you've needed this medication because the theory of medication is chemical imbalance, right? And it's accurate. Serotonin, dopamine, epinephrine, those things are all out of whack. But those are neurotransmitters. So they transmit messages for the neuro system. So when you get to root cause work like you guys do and we do, and you get to the nervous system and you get it healing, well, then the chemicals start to get back in balance because that's what they wanted to be all the time. And so you reach this first point where you can tell the child's nervous system is starting to heal, and you reach kind of this tough point where the medications could actually turn in the other direction and be a big detriment, right? And so the cool thing about the scans I brought up before is we can actually see that happening, and then we can get out ahead of that. It's not in my scope of practice. Thankfully, I do not want that responsibility at training in pharmacology. So what we do is we communicate to the parents and we say, hey, and we do this all along the way, just like you do on your awesome platform. We are all about empowering, informing, and getting our parents to advocate for their kiddos. And we say, hey, we're at this point, you want to get your child to the other side of these medications. So go in, book that appointment, get connect with your doctor, have this conversation. We'll send the scans. I'll connect. I make myself available to any doctor of any initials, anytime to help a kiddo get to the other side of this. And it splits this way, Pamela. Half the time, which it didn't used to be half the time. So this is a good growth forward within even the traditional system. Half the time, the doctor will listen to those parents and say, okay, I see you want to get there, and I'll work alongside you and your care team and make it happen. The other half the time, you know what sometimes doctors do, right? And they say, oh, yeah, and they try and threaten and scare the family. And so, you know what? We got a list of other doctors that we work hand in hand with. And so we just encourage that family to go, hey, that wasn't your doctor. If they're not going to partner with you, listen to you, and empower you, there's others. And so you go get that second or third opinion, and we work together as a collaborative team. And thousands of cases of kids who started with us that were medicated are not at all anymore, or at least have been able to come down significantly. And man, you could probably tell that run really hits me. My son had to be on he had a traumatic birth, and it was absolutely right for the first few weeks for him to be on a real heavy hitting, anti-seizure drug, because we just needed to hit pause to get healing happening. But I really despise those medications because they get in the way of not just healing, but they get in the way of like neurodevelopment and a child living their best life. So anytime we can cross that gap, man, do we work our butts off to do it.
That's awesome. Anything else that I have not asked you want to make sure we talk about, how people find you?
Yeah. Moms, dads, I'm just going to show my Iowa English right here, Pamela. You gotta, great word, you gotta heal too. Your nervous system is toast. Not a single one of us, when our kiddos go into this sickness and storm, our kids don't go alone. We go in awesomely emotionally invested with them. And that stress really gets us buried as well. And we're not just connected as a family unit based upon our genetics and our zip code. We are really tied into our nervous systems. And so one thing, I was actually on our podcast, so the Experience Miracles podcast, which I'm brand new, Pamela. I'm so nervous. So far, people are loving it. It's going well. But so that just launched, and I got to interview. So we got to turn the tables. I got to have you come on, and we'll dig in just this way. But I was jamming with Beth Lambert on the one that released today. And I asked her, I said, out of all the things we can do, what do you find is the cheat code to getting kids better? And she said it. So I've always known this, and we always do this in the practice, but I haven't been as verbal, which is why I'm going here towards the end. She said, those moms and dads, they got to get their nervous system. They got to get themselves healing too. It's such a unlock for the child to heal. And which is the same thing as saying it can really limit our kids' healing if we're locked in, if we're anxious.
I found that it's just it becomes a family ordeal so many different ways.
It does. So yeah, so you can find out more about all the work we do. We are go-getters. So now my ADHD is, the last D is not accurate. It is not a disorder. Every single morning, I thank God for giving me ADHD, because I get more stuff done and I'm a farmer too, so I do wake up early. So I get more stuff done by 7 a.m. than most people do in 7 days, because now I've got my nervous system balanced. I'm living a healthy lifestyle. I'm taking my supplements so that everything's coming in that channel is really well. And so we do a lot. So you can find us. Our podcast, the Experience Miracles podcast with Dr. Tony Ebel, is new, and it's rocking and it's good. Our Instagram at PXDocs. So X stands for experience. Our organization is called the Pediatric Experience. And then so Facebook, Instagram, you can find it that way. And then our website is www.pxdocs.com. And that is full of articles. I love to write and make this simple for parents. And so there's a lot of really cool articles and educational resources on there to learn more. If this is starting to make sense, but you want more info, that's how us parents, that's exactly what you should do. Go there and you can get the articles and the videos, YouTube too. But then the cool thing about pxdocs.com is that's where the directory is, because, if you're not in my area, I can't be the one to create the adjustments, and our doc team to do that. So we did build that network so that all this content and all this, what we call hope, answers, and help, well, the help is in your local PX Docs office. And my prayer is that we have somebody, 7.2 miles or less away from you. So go to the directory, find them, give them a call. You can reach out right through that directory. You just put name and email and we'll connect them with you and to you. But that's where I'd send folks for sure.
Awesome. Thank you so much, Doctor. We really appreciate having you on today.
Absolutely. Thanks for having me. Parents, just know this. Your kids are designed to heal. You are the bosses that make it happen. And there's so much forward action. And the cool thing is when we do this for our kiddos, they're not only going to heal, but they're going to be ahead of this stuff for their kiddos and for generations to come. So thank you for having me. We love your platform. We send links out all the time to our patients to get the educational resources you have. So thanks for having me, Pamela.
Awesome. Thank you.